Thank you very much for the opportunity to speak on what is global health informatics, a clinician's view. Thank you to the organizers for this opportunity and to each of you for tuning in. Looking forward to this discussion. My name is Andrew Steenhoff. I'm the Medical Director of the Global Health Center at CHOP. And let's move on to the next slide. I'd like to start with this case. This is a picture from Botswana where a healthcare worker is doing TB contact tracing with a patient. He's asking her about TB and her exposure to tuberculosis. This is a project that was originally started on paper, where the healthcare worker would fill out records and the answers on paper. And then after about a year, we moved to using an mHealth medical informatics approach. And the healthcare workers loved it. They found it easier. They said there was no need for double data entry, and they felt it made their work more efficient and easier. In addition to their report, the mHealth informatics approach was also associated with a halving in time per patient for each interview. And there was a significant increase in data accuracy. In the paper version, we had up to 78% missing values for at least one value, versus in the mHealth informatics approach, there was 0%. So this tiny example of an mHealth clinical application in the field is one example to start with. Next slide. So today we're going to speak briefly about what is global health informatics, how can it advance healthy lives for all, particularly thinking about pediatrics, and also ask how can each of you get involved. Next slide. So let's start with the first one. What is global health informatics? Next slide. So if we turn to AMIA, the American Medical Informatics Association, their definition of informatics is that it is the science of how to use three things: data, information, and knowledge to improve human health and the delivery of healthcare services. Next slide. I'm a visual person, so I like to put this into a picture, and you can see here a little funnel of those three elements: information, data, and knowledge, which are being used to improve human health and delivery of healthcare services. Next slide. Obviously, today we're talking about global health informatics, and so what global health informatics is using these three items: information, data, and knowledge, to improve human health and delivery of healthcare services globally. Next slide. But I'm also someone who likes to try and keep it simple, and so I love this definition that I found, where global health informatics is putting technology to its best use in patient care, clinical care, educational, and research settings to advance global health. Next slide. So let's talk a little bit then about how can global health informatics advance healthy lives for all. Next slide. And when I think about this topic as a pediatrician, as someone who's been working in the global health space now for over 15 years, there really are a myriad of opportunities. And this is exciting because I think whatever your work is, and wherever your partners are working, whether they be in high or low middle income settings, there are opportunities for you to think about using global health informatics to advance and improve your work. Next slide. So as we think about ways to use global health informatics in pediatrics, I think this slide summarizes the opportunities best. And this is a slide from the Lancet of February of this year, which shows the global causes of deaths of children under 5 in 2019. And we can see deaths of neonates aged 0 to 27 days on the right-hand side, and deaths of children aged 1 to 59 months, or essentially under 5, on the left-hand side. And you can see the range of causes at the moment globally. Infections, preterm birth in neonates in red playing a big role, intrapartum related events, sepsis, even injury. And then going on to pediatrics, we can see lower respiratory tract infections, about 10% of cases in light blue, tuberculosis about 2.5%, malaria 7.8%, diarrhea down the bottom in orange. So these are some of the big causes of mortality and under 5 death. And global health informatics can be applied to each of these causes. I'm not going to give you examples of all of them, but I encourage you to think about this and even to search both in your own institutions and online about examples. One example is, for example, pneumonia in neonates or in children. There's been a lot of use of mHealth with teleradiology. Dermatology is another example where teledermatology has been used, and there are many educational applications as well. So whatever your content area is, whatever your partner's need is in a low and middle income setting, or if you're coming from a low and middle income setting and you have needs and want to partner, there are ways certainly to incorporate global health informatics to help advance child health. Next slide. So finally, how can you get involved in global health informatics? Next slide. And I encourage you, whether you're based in a low and middle income setting or in a high income setting, to join a global health partnership. And I'd suggest that you think about joining a group with these practices and principles. And the 7 guiding principles form the roof of this house. High quality global health partnerships are those where there's mutual benefit for low and middle income partners as well as high income partners. There's humility from both sides. There's a sustainable approach that's being used. There's prevention of adverse impact. Again, we all engage in global health with good intentions, but we need to be aware that sometimes even with good intentions, we can cause adverse impact. There needs to be inclusivity, there needs to be an ethos of social justice, and all of this with an apex of equity. And then below you can see some of the core practices that help global health partnerships to function well. High quality communication, transparent, effective leadership, conflict resolution. We need to be able to work well together, but we also need to be able to discuss and disagree well together in working on these difficult global problems. And then also a partnership that has an evaluation component. So I encourage you to look at your institution, at the institutions around you for partnerships that use these guiding principles and practices. And I think that's an excellent way to start out in global health informatics and to be a part of this space. If you'd like to read more about this approach, you can find it in pediatrics with the reference below. Next slide. So in summary, thank you again for this opportunity just to give a little teaser from the clinician perspective, from myself as a pediatrician. We've spoken about what is global health informatics, and simply put, it's putting technology to its best use applied to global health. How can global health informatics advance healthy lives for all? Well, we've touched on one TB contact tracing example. We've spoken briefly about teleradiology, teledermatology, but there really are a myriad of opportunities which can be applied to that pie chart of causes of under 5 mortality. And finally, how can you get involved? We're going to hear from other speakers today, and we'll have a good discussion together. But I encourage you, if you're not already, to get involved in a global health partnership, to speak to colleagues both in low and middle income countries and to high income countries, depending on where you are, to find out what the needs are and what the skills are, and to try and match these together with your skill set. So I'd like to thank you at this time, and I'm going to turn it back to the organizers, and very much looking forward to hearing from our other speakers and also to the question and answer session. Thank you.